You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS, and today we are joined by Tony Ellis, Executive Director of the Oncology Nursing Certification Corporation, which we'll call ONCC for the rest of the episode, to discuss changes to ONCC certification for 2021. Thanks for joining me today, Tony, and Happy New Year.
Well, Happy New Year to you. Thanks for having me.
Great. So, to start us off in this new year, can you describe the oncology nursing certification changes that nurses can expect for 2021?
Sure. First, the ONCC Board of Directors approved a change to the definition of nursing practice used in determining work experience that can be used to meet the test eligibility and renewal requirements. Formally, the position in which the work was performed had to be one that could be filled by an RN and only an RN. Effective January 1st, though, positions that may be filled by another licensed care provider may qualify as nursing practice so long as the position may be filled by an RN. Other changes and new offerings from ONCC include the move to a new test administration partner, PSI, the double take offer for test candidates, emeritus status for retired ONCC certified nurses, and digital badges from ONCC to recognize their certification in the digital space like LinkedIn and Facebook. We're also taking a look at our free take, the employer partnership program, and exploring options to help smaller institutions increase the number of certified nurses by more easily taking part in the free take program. And then finally, we know that we all remain in difficult times with a lot of the in-person educational events being canceled. So we continue to help nurses find free CE with our big lists, which are available on our website, oncc.org.
That's a lot of stuff. So, I think that those are all really exciting changes. And also, just in light of everything that's happened this year, there are a lot of changes in nursing itself and, different roles that nurses are playing and finding themselves in now. So, in talking about some of this, how do the changes affect oncology nursing certification?
I think overall, the changes and the new offerings that we're bringing out in 2021 help to broaden access to our certification programs to more nurses and increase ways for certified nurses to be recognized and show off their credentials to others and help retired certified nurses continue to champion for nursing certification via emeritus status, for example. The double take offer provides a new way for candidates to manage the pressure or anxiety related to sitting for the exam, hopefully helping them be more relaxed and focused on the test on test day versus what's at stake relative to passing or not passing.
One of the things that you talked about right at the very beginning was the change in the definition to nursing practice. And as I alluded to right before our last question, with everything that has happened over this past year, so many practices going to virtual patient appointments and things such as that, and just the moving and shifting of positions, let's say, there are nurses that are doing roles that are different than maybe they've seen themselves do before. So, can you talk a little bit more about the revised definition of nursing practice and how does it affect the potential candidates that we have?
Certainly. Well, our previous definition for nursing practice, as I mentioned earlier, required that the position that the nurse is working in to earn that work experience for eligibility be one that can be filled by an RN and only an RN, which means other licensed professionals couldn't be allowed to fill that position. And so, one of the things that we recognized through some of our strategic planning work and the Nurse of the Future project through ONS that we were a part of as well, was that nurses are taking on new roles. Their roles are expanding, and there's more gray space there than there used to be. In addition, we're seeing institutions simplify some of the work from a human resources standpoint and broadening those job descriptions, which then becomes problematic for a nurse who has a position description that no longer requires that an RN and only an RN can fill the position. So the ONCC Board of Directors established a task force that did a comprehensive review of the literature, not just of our definition of nursing practice, but also what does work experience mean as an eligibility criteria, and how should we define that, and how does that fit into the overall picture of what's happening in our specialty nursing practices that our certification programs cover. And so it was upon their recommendation and the outcomes of their work that the board changed our definition of nursing practice to no longer require that the job that the nurse performs that work in be filled by an RN and only an RN. Other licensed professionals can be listed as eligible for the position in that job position description. As long as an RN may fill the position, it will qualify. So what it does is it makes our certification programs accessible to nurses that hold those positions that previously would not have qualified for that eligibility requirement of nursing practice. In some cases, nurses were not able to renew because they'd moved into a position that was impacted by the former definition. So in reality, we're talking about a relatively small number of nurses that would be impacted by this change and were impacted by, negatively by the previous definition. But we're very excited that they can now consider pursuing or renewing one of our credentials when before they couldn't.
That is really exciting. I think that nurses are going to be very happy with that change, and it just helps them to show their expertise in the area of oncology when they are being asked to work in different roles, and being concerned that maybe that was not going to be the case, and they either weren't going to be able to take the certification exam or to renew because they had previously they had their certification and that job change happened, and now that will be able to continue. So that's really an exciting change, I think, for everyone. So when you're talking about the changes that you all make to certification, what are some of the factors that you consider when doing this?
Well, that's a great question. And to be sure, no change in our eligibility criteria, the certification exam content, or other aspects of our credentialing programs are made lightly. We conduct what is called a role delineation study every 4 years for each credential to determine any changes in the professional role. And those studies can also drive changes in the exam content or other eligibility criteria. The RDS studies engage hundreds, if not thousands, of content experts from the specialty. They provide input via surveys, focus groups, interviews, and serving on the task forces that are part of the process. In short, we look at the body of knowledge and the pace of change in the practice. We consider both what is important to know and how often and critical a given task is to the work the nurse must perform. Overall, it's our job to ensure the safety of patients and the caliber of practice by maintaining a current and appropriately rigorous set of criteria. We call it the 4 E's: education, experience, ethics, and exam, which is the test of the knowledge. And we maintain that so that nurses, have to successfully demonstrate in all four of those areas together in order to hold our credentials.
That's such a great explanation of how that works, and just the fact of explaining the role delineation study, because just as we've been talking, things change quickly. The landscape of healthcare changes so quickly. And in oncology, we have seen so many changes over just the last few years, even with the number of new treatments and therapies that are coming out. And and how those therapies are administered. So, you throw in 2020 and, how we actually do practice, and recognizing that 2020 is going to affect how we move forward in our practice and care of patients. So, recognizing and seeing that you all really take very seriously those role delineation studies to determine how certification is done is so important, and really good for, I think, our listeners to hear and understand how that actually takes place. And in light of that, that's probably part of the reason why you all created the new ONCC double take option. And can you explain why nurses should consider this option?
Sure. It's double take is kind of the individual's version of the benefits that are available through our free take employer partner program. Double take is designed at its core to reduce the pressure to pass when sitting for the exam, mitigating the fear of failure just a bit, which is one of the top concerns for exam candidates. So when a nurse applies for the certification program, they have the option to purchase the double take for an additional fee. Kind of like an insurance policy, double take allows a candidate that's unsuccessful on their first attempt to take the exam a second time for a reduced fee, which is the cost of the double take option, just $100. Without double take, if they weren't successful on their first attempt, they'd have to reapply to the program at the full application fee. So with Double Take, they save up to $316, and on that first attempt, they have some of the weight lifted off their shoulders and their brains for that first time at the test.
I can't tell you how much I wish that would have been an option the first time I took the test. Now, I did pass it the first time. However, personally, have really bad test anxiety. So to have that kind of an option, how wonderful for folks. And, honestly, an additional $100 to take that off my anxiety list, I think I would have done it. So let's talk about activities that make nurses eligible for taking the exams. What are some of those when you're looking at the nursing practice hours? What are the eligible activities for that?
Sure, that's a good follow up to the conversation about the definition of nursing practice. And in fact, though, there have not been any changes made in the types of activities that are eligible for nursing practice hours, only in that job description regarding who can fill the position that I mentioned earlier in the definition of nursing practice. So, for the activities that they can do, nursing practice still may be work experience that's direct and or indirect patient care in clinical practice, nursing administration, education, research, or consultation in the specialty that's represented by the credential.
Okay, that's good to know. So, how is ONCC adapting to testing in the era of COVID-19? And what are those changes mean for certification?
Good question, because I know that's on all of our minds. Well, as you probably know, and I think many of our certified nurses know, ONCC certification programs are accredited by the NCCA, or National Commission for Certifying Agencies. So they establish standards that our programs have to meet in how the program is run, how the tests are constructed and administered, how they're scored. The NCCA just completed last fall a study and announced that accredited programs can meet NCCA standards when administering their tests via what's called live remote proctoring. That was not the case previously. So, live remote proctoring is a test administration scenario that allows candidates to take the exam from any private space on a computer that uses a locked down browser through our testing provider. The private space could be like a home office or any room in your house that could be closed off, or private, where you don't have others coming into the view, or any kind of disruptions or things that might enable you to do bad behavior when taking the test, for example. There are certain protocols that have to be followed, and the test administration is under the supervision for the duration of the exam by a real-time proctor via audio and video connection. So we're not doing live remote proctoring now, but now that the NCCA has approved live remote proctoring for accredited programs and that we can retain accreditation if we were to move our exams to live remote proctoring, we are going to start the process of exploring the viability of live remote proctoring for our programs over the next 12 to 18 months. Obviously, live remote proctoring would allow candidates to test without having to go into a public testing center where the risk of exposure is a little bit higher.
That's amazing. That's absolutely amazing that it can, be an option and going forward, but also what a wonderful option, especially in light of how things are right now. So until then, how are you conducting in-person certification tests in social distancing environment?
Yes, good question. Our testing services provider, PSI, has a comprehensive set of test center safety precautions, both for the candidates and for the center staff. The seating capacity has been reduced to allow for safe distancing between candidates. Testing equipment and other items and surfaces are sanitized after each use. Masks are required at all times in the facilities, and candidates can even wear gloves during their test administration if they choose. Full details are available on PSI's website and linked from the ONCC website, of course, for candidates. If there was an instance from a contact tracing standpoint where a candidate might have been exposed during their test session, they're contacted immediately to let them know that. We are also contacted so that we know that that has happened. And the test centers, by PSI protocols, are closed and sanitized before they're reopened and to test other candidates. So also, I think it's worth mentioning that because scheduling can be a challenging because candidates may be exposed in other places, not before their test appointment, or they may just not want to get out into public and potentially run the risk. um, the rescheduling rules and fees for our exams and through PSI are all currently being waived to provide greater flexibility. So, if anyone has any questions or concerns about that, they could certainly contact ONCC or PSI and we could let them know what their options are.
Okay. Well, it sounds like you all and PSI have done a really great job at, making the testing locations safe for our candidates and, a good environment for them. So, as we've been talking about changes, are there any new requirements for recertification that you all have made for 2021?
There aren't any new or changed requirements for renewal of certification in 2021, but I would take this opportunity to remind our certified nurses that are in their second or subsequent renewal cycle that they must complete the Individual Learning Needs Assessment, or ILNA, and receive their required points in content areas for renewal before any CE or continuing nursing professional development credits they complete can be used towards their current renewal. So, the longer you wait to assess, the less time you'll have to accumulate the necessary CNPD credits. And in our direct messages and reminders in our newsletter that we send out to our certified nurses about this are all starting now. So if you haven't received one of those, you'll probably be receiving it soon. But even folks that don't need to renew for several years, really encourage you to go ahead and complete the ILNET assessment so that the next CE that you complete, activity that you do, will count towards your renewal. So you don't lose that.
I think that's so important to point out. I know for myself, when I am staffing at whether it is ONS Congress or some of our other educational conferences, that is a question that comes up all of the time. And, I can tell you that I remember from being at the TCT nursing conference for the bone marrow transplant nurses that So many times they come in the very beginning at the first day and they're like, "Oh, this is so great. I'm going to get all of these points for my renewal." And I say, "Have you taken that your ILNA assessment and checked into that yet?" And they're like, "Oh no, I haven't done that part yet." And and I always say to them, "You need to go back to your room right this minute and take that needs assessment." Just so that they do, because, so many times nurses are thinking about that and they don't think about it immediately, or they think about it closer to their renewal time. And like you said, those credits can't be used until that needs assessment has been done. So it's so important that folks hear that. And even if they're not due for renewal for a little while, do it ahead of time. I'm sure that they think, "Oh, I took the test and I passed and I don't have to think about this for how long till my renewal." But it's really important to get that done.
It really is, and we've started sending out before some of the major industry events that we know are primary sources of CE for our certified nurses, like Congress or APON's annual meeting, some of those kinds of events. We send out notices a month or so in advance to remind folks that they need, they might want to make sure they have completed their assessment before they attend, because we know people get caught. We've even seen a little jump in activity in the assessment, from the administrative side right around those events, because people realize they need to assess and they jump on and complete that. You just need that 2 hours of uninterrupted time to sit down and complete the assessment, and then you're good to go.
Yeah, that's very important. And that's great that you guys are doing that before those big meetings. And I'm not surprised at all that you guys see a jump in the assessments right beforehand. What are common misconceptions about ONCC certification?
That's a really good question. I think I probably would want to talk a little bit about certification in general, and how it differs from certificates, because obviously we're very close to those topics as professionals in the credentialing arena, but most people who hold a credential, most people from all professions, as a matter of fact, don't distinguish between a certification versus a certificate program or a certificate of completion, like for an online course, for example. But certifications and certificate programs have specific and unique functions, and knowing the difference between the two can help certified nurses understand why we do some of what we do at ONCC. So, certificate programs, especially assessment based programs, are created to address a finite set of content, to teach the learner a specific skill or set of topics, like an online course that might address the basic principles of survivorship, for example. And the assessment at the end will be directly derived from and cover the content in that course. Certifications, however, are based on a body of knowledge and full scope of practice that isn't learned in any one setting or covered by a single textbook. So people often call us and they want to know, which book do I study? Or why was that topic or that subject not on the certification exam? And with certifications covering that full body of knowledge, there's not just one book. There's a list of references that we use to create a reliable test of the nurse's knowledge on a sampling of the full body of content that the credential represents. And I mean, certainly the exam reference list is something that candidates would want to review to find sources of study material, but that's often a lot of content. And that, again, that leads to that question of which one of these books should I read? And it doesn't quite work that way, because it covers something that is expected to be learned over a stretch of time in both work experience and education, kind of going back to those three E's that I mentioned earlier, which is why our eligibility criteria for the credential is not just taking the exam, it also includes education, the code of ethics, and work experience, right? So, to kind of sum that up, Certifications are summative in that they're a capstone of accomplishment. They represent how the individual has gained the knowledge and experience that covers the breadth of the practice. And in ways, certifications are also aspirational in that they make us learn and grow beyond the confines of what our specific job might entail in one practice setting versus another, to include knowledge and the ability to apply that knowledge for the entire scope of the nursing specialty role. So, in that way, certifications can make certified nurses' knowledge and their view of things bigger and broader.
That's a really good explanation. And I can, again, remember back to when I was taking my first certification exam. My experience and all of my clinical was in bone marrow transplant. And at that time, the OCN exam was the only not the only certification, but was the certification that I was eligible to sit for. And I can remember thinking, wow, I don't know a whole lot about solid tumors, and I don't know a whole lot about, let's say, radiation outside of the type of radiation that the bone marrow transplant patients received. And so that was one of the things that was a little intimidating for me as a nurse, going to take a certification exam that was, like you said, it is the full body of knowledge or scope of practice in oncology, and really as a generalist. And until that the BMTCN certification came out, that is what the transplant nurses would take. And so I would hear them often, and I would remember, wow, I didn't, this is my little area, and I feel confident in that area of oncology, but not so much maybe in some of the other areas of oncology. But I think that's a really great way to explain to nurses who may be listening to our podcast today that, take a look at that and look at the areas where you might not feel as strong in. And, those might be the areas that you want to focus on your studying a little bit more, because you are confident in the specialty area that you're in, but there might be some other areas that you might need to expand on a little bit more. So that was a very good explanation of those differences, and thank you for that. So what is something about ONCC certification that is not often discussed but you wish people knew more about?
Well, I think this is a really good question, and we've done a little work in this area, but I would have to say the importance of certification to our patients. Patients want expert care. There was a poll of 2,200 adults conducted by the international consulting firm Morning Consult for the American Board of Nursing Specialties in June of 2020. The sample was designed to be representative of the larger population, and it found that two-thirds of adults have a favorable view of board certified specialty nurses. 75% of adults think it is important that all nurses are required to have a specialty board certification in their field. And two-thirds of adults support hospitals requiring their nurses to have a nursing board certification in order to be employed in the hospital. So we know that employers value certification and that there are benefits for both the institution and the nurse individually. I think it's important for our certified nurses and other stakeholders also to know and keep in mind that their patients truly value the time and energy they put into becoming certified and maintaining their credential. They want expert and confident care, and they see nurses, certified nurses, as an important part of their care team. And we have a template on our website that you can pull down that's a little card. You can print them out yourself, or we can send them to you if you ask for them. That is a very, very quick and simple explanation of the value of the nurse, that individual's nurse being certified, what that means to the patient. And we've heard great stories at different conferences from nurses who have used those to help their patients understand why their being certified is a benefit to them. So that's one way that we have helped to get the word out about the value certification to patients. And I just wanted to, double down on that during our conversation, because I do think, especially now, because we know that patients have a lot more going on in their minds when they're making decisions about coming in for screening or for pursuing treatment because of everything going on in the current healthcare crisis.
That's good to know, and I think that that's a great resource, that you have for nurses that explains to their patients, and I know that patients do really care about the nurses that work with them and do appreciate the expertise that they have in that area, and it makes the patients have a confidence and a comfort level in who's caring for them. So thank you for sharing the results of that study. That was wonderful to hear. So, talking about resources, what are some resources for nurses who are wishing to pursue ONCC certification or learn more about it that you have available for them?
Well, certainly the ONCC website's the place to go. You expect me to say that. And that's oncc.org. We have information about each of our certification programs, the eligibility requirements, and the entire process from signing up to what to expect on test day and beyond. They can download the candidate registration brochure that has all of that information if they want to have it handy or for reference. The exam content outlines for each certification are online, as well as other preparation and study tips and resources like our practice tests that can give the candidates a sense of what the certification exam entails. There's information on our website about the Free Take Employer Partnership Program, ways that employers can better support nurses that are seeking certification, and probably would want to point out that right at the top of our site on every page is a link to our benefits of certification information. So that might be a great place to start if someone really knows nothing about it and is trying to figure out, should I do this? Does this make sense or have value to me? And of course, we'd be happy to talk to anyone that's interested in one of our certifications. So folks can just drop us an email or give us a call. We'd be happy to chat with them.
Tony, you've given us a lot of information today about ONCC and certification and what you all have to offer. It has been extremely valuable, and I really believe that the nurses who listen to the podcast will appreciate all the information that you shared with us today. So, in conclusion, do you have any final comments that you would like to give to those listening?
Well, I'd certainly like to thank you for the opportunity to be here and to share some of this information. It is a lot, and we'd be happy to break that down for folks, or they can visit our website. But I think in closing, I know it's been said by many, many people, but I think I would like to thank all of our certified nurses and the candidates and all of the healthcare providers and other essential professionals that have given so much during this global health crisis to ensure safe and uninterrupted patient care. You are all true champions, every one of you. So thank you.
Thank you, Tony. We appreciate you being with us today. Hope to have you on the podcast again sometime.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.